what if the reason a flawlessly graded, completely genetically perfect IVF embryo fails to implant has, well, absolutely nothing to do with the embryo itself?
Right. Which is a wild thought for a lot of people.
It really is.
Yeah.
Like, what if it has everything to do with the microscopic blood flow in the exact environment where it's being placed?
Yeah.
Because, look, when you first step into the world of fertility treatments, it usually doesn't take long before it feels like you are walking completely blindfolded into a blizzard.
Oh, absolutely. It's a whiteout.
Yeah, you're suddenly surrounded by this absolute whiteout of overwhelming medical jargon, high-stress decisions, and this ticking biological clock that just seems to drown out everything else.
It is an incredibly vulnerable position for anyone to be in. I mean, you are essentially being asked to absorb a master's degree worth of reproductive endocrinology in, what, a matter of weeks?
Seriously, weeks.
All while navigating these just immense emotional and financial stakes. It's a lot.
Which is exactly why we are doing this deep dive today. Our mission here is to cut through that blizzard for you. We have a really fascinating stack of sources to unpack. We're talking systematic reviews, clinical trial data, historical medical profiles. And we are looking at how integrative medicine, specifically traditional Chinese medicine, so targeted acupuncture and individualized herbal therapies, is currently being utilized right alongside highly advanced modern Western fertility treatments.
And we really need to set the stage properly for this right up front, because the goal of this discussion is not, to pit Eastern medicine against Western medicine.
Right. No cage matches here.
Exactly. No cage match. What our sources highlight are the peer-reviewed mechanisms, the actual biological pathways of how these two very distinct paradigms can actually work synergistically, like how they work together to optimize the body's internal environment.
Okay, so let's unpack this. I want to start with the foundational physical environment. So the uterus and the ovaries. If we think of the reproductive system like a high-stakes agricultural project, you can go to a top-tier IVF clinic and get the absolute best seed possible.
The pristine embryo.
Right, the perfect seed.
Yeah.
But if you take that embryo and plant it in an environment that is dry or just devoid of circulation and nutrients, the chances of success just plummet. So looking at the clinical data, how does a treatment like acupuncture actually change the physical environment of that tissue?
What's fascinating here is that we aren't talking about some vague esoteric concept of energy moving around.
Right.
We are talking about the strict biological mechanics of microcirculation. The data demonstrates that acupuncture physically increases tissue oxygenation and it improves endometrial perfusion.
Let's define that for a second, just so we're all on the same page. Endometrial perfusion just means a volume of blood actively flowing into the lining of the uterus, correct?
That's exactly it.
Okay, but how does a needle actually do that? I mean, I understand rubbing a sore muscle brings blood to it, but a tiny needle seems way too small to make a systemic difference.
Yeah, it seems counterintuitive, but it comes down to localized microtrauma and the nervous system's response to it. So when an acupuncture needle is inserted, it creates a microscopic injury.
Okay.
The body instantly detects this, right? And it triggers a localized healing cascade. One of the primary things that happens in that cascade is the release of a molecule called nitric oxide in the blood vessels surrounding that specific area.
Oh, and nitric oxide is a vasodilator. It basically tells the blood vessels to relax and open up.
Precisely.
Yeah.
It opens the floodgates. By placing needles in specific dermatomes...
Dermatomes being out.
Right, areas of the skin that are connected by nerve pathways directly to the pelvic organs. So by hitting those spots, you're forcing the body to dilate the blood vessels feeding the uterus and the ovaries. The data really highlights that manual acupuncture, particularly when it's performed just before an IVF embryo transfer, it measurably increases those endometrial blood flow indices. Wow.
Yeah, you are driving oxygen, nutrients, and crucial hormones directly into the tissue, resulting in a thicker, a more receptive endometrial lining.
So you are quite literally watering the soil before planting the seed.
Exactly. And this extends way beyond the uterus, too. Increased blood flow to the ovarian follicles supports better egg maturation.
Really?
Oh, yeah. It improves the competence of the embryo before fertilization even occurs, simply because the developing egg wasn't, starved of oxygen during its really crucial growth phase.
I see. So we are essentially forcing the body to deliver vital resources to the exact tissues that need them the most. But obviously you can have all the blood flow in the world, and if the body isn't sending the right chemical signals, well, that blood isn't going to do what we need it to do.
Right. It's just plumbing without instructions.
Exactly. So if blood flow is the physical environment, the plumbing, we have to talk about the wiring, the chemical messengers telling the system how to operate.
You are referring to the nervous endocrine regulation. Yes, and I really have to push back here because this is where a lot of people, myself included, naturally get skeptical.
Yeah.
I can completely wrap my head around a physical needle causing a localized nitric oxide release. That's basic physics and biology.
Sure.
But how on earth does poking the skin change complex hormone levels?
Yeah.
Like, how does a localized skin puncture affect something systemic like insulin or luteinizing hormone?
It's a great question, and to understand it, we really have to look at the communication relay between your brain and your reproductive organs. This is called the hypothalamic pituitary gonadal axis, or the HPG axis for short.
Okay, so the command center of the brain talking to the ovaries or the testes.
Exactly. When a needle stimulates a sensory nerve in the skin, that signal travels up the spinal cord and directly into the midbrain, specifically affecting the hypothalamus.
Okay.
This sensory input can actually alter the release of neurotransmitters, like beta endorphins. But perhaps the most critical mechanism we see in the literature is that acupuncture physically downregulates excessive sympathetic nervous system tone. Ah, the sympathetic nervous system, that's our fight or flight response, right?
Yes, exactly. When you are chronically stressed, your body is just bathed in stress hormones, and your brain essentially decides that right now is a highly dangerous time to reproduce.
Which makes sense from an evolutionary standpoint.
Totally. So it suppresses the HPG axis, but by stimulating specific nerve pathways, acupuncture triggers a shift toward the parasympathetic state, the rest and digest state. It physically commands the brain to stand down.
That is wild. It's essentially hacking the feedback loop. By convincing the brain the environment's safe, the brain allows the reproductive hormones to come back online.
Right, and the clinical trials for this are particularly compelling when we look at conditions characterized by, well, hormonal chaos, like polycystic ovary syndrome or PCOS.
Yeah, which affects so many people.
It does. And trials demonstrate that electroacupuncture, where a mild, totally painless electrical current is passed through the needles to continuously stimulate those nerve pathways, it can dramatically improve ovulation frequency in patients with PCOS. Because PCOS is notorious for throwing androgen levels and luteinizing hormone way out of balance.
It is. But by calming that nervous endocrine feedback loop, electroacupuncture helps correct those imbalances. It even increases insulin sensitivity.
Wait, hold on. It improves insulin sensitivity just from modulating the nervous system.
Yes, because chronic sympathetic tone, that fight or flight state, it actually drives insulin resistance.
I didn't realize that.
Yeah, when you dial down the fight or flight response, cellular receptors become more responsive to insulin again. And this cascades into supporting a healthy luteal phase.
Okay, let's clarify the luteal phase for anyone who might not be completely familiar. That is the window of time right after ovulation before a period starts where the body pumps out progesterone to hold the uterine lining in place, right?
Correct. If your luteal phase is too short or progesterone levels are too low because the hormonal signaling is compromised, an embryo simply cannot implant and survive. Regulating that HPG axis ensures that the luteal phase remains robust.
Here's where it gets really interesting, though. We have the localized blood flow delivering nutrients. We have the brain sending the correct hormonal signals. But even with those two systems optimized, our sources point out a third major hurdle.
Right. The cellular environment.
Exactly. You can still have a hostile cellular environment that just derails the entire process. I'm talking about inflammation and oxidative stress.
The silent saboteurs of reproductive medicine.
I love that phrase. I tend to think of oxidative stress like rust accumulating on the gears of a machine, or maybe a thick toxic smog settling over a city. It just suffocates cellular function. And the crucial thing the researcher emphasizes is that this smog affects both partners.
That's key.
It is not just a female factor. So how do integrative therapies, specifically the individualized herbal medicines mentioned in our sources, how do they actually clear this smog out?
Well, this raises an important point about how we fundamentally view fertility. Historically, the medical burden has fallen almost exclusively on the female partner.
Right, always.
But the data clearly shows this is profoundly a couple-level biological issue. Let's look at inflammation first. Individualized herbal medicines and acupuncture work by reducing the concentration of pro-inflammatory cytokines in the body.
Cytokines are essentially chemical alarm bells, right?
Right.
They're proteins secreted by the immune system that tell the body to attack an area.
Exactly. When cytokines flood the pelvic cavity, the immune system becomes hyperactive. The environment becomes toxic to delicate cells like sperm and eggs. For women, lowering these pro-inflammatory cytokines drastically reduces the pain and the formation of adhesions that are associated with endometriosis.
Endometriosis being a condition where tissue similar to the uterine lining grows outside the uterus, causing massive inflammation.
Yes, and that inflammation creates a highly hostile environment for gametes. The immune system is essentially attacking the reproductive space. By cooling that localized inflammation through, herbal modulation of those cytokines, you stop the immune system from acting like an aggressive bouncer. You create a hospitable environment for fertilization.
That makes total sense for the female reproductive tract. But you mentioned treating both partners. How does clearing this smog apply to the male side of the equation?
This is where herbal therapies with specific antioxidant properties become absolutely vital. Our bodies constantly produce reactive oxygen species, or ROS, just as a byproduct of normal metabolism.
Okay.
They are unstable molecules that steal electrons from other cells, causing damage. In the male reproductive system, high levels of ROS directly damage sperm. So herbal antioxidants provide free electrons to neutralize these ROS, essentially clearing the rust.
And the systematic reviews in our sources show that neutralizing ROS leads to a consistent reduction in something called sperm DNA fragmentation.
That is the key metric, yes.
Let's pause here because this specific mechanism just blew my mind. From what I read in the deep dive sources, a sperm with fragmented DNA, meaning its genetic code is literally fractured, it can still successfully fertilize an egg.
Oh, it absolutely can. The sperm can swim, it can penetrate the egg, and fertilization can occur as if everything is fine. But once the sperm is inside, the burden of repairing that fragmented DNA falls entirely on the egg.
Wait. The egg acts as a mechanic.
Yes.
And repairing DNA requires a massive amount of cellular energy.
It is a huge energetic drain. It forces the egg to deplete its mitochondria, its power plants, just to fix the sperm's broken DNA. If the egg exhausts its energy reserves playing mechanic, the resulting embryo's quality drops significantly. It might stop growing on day 3, or the risk of miscarriage goes up dramatically.
Wow. It is the ultimate team effort at a microscopic level. So by using antioxidant therapies to reduce oxidative damage in the sperm before fertilization, you are directly preserving the mitochondrial function in the egg. You are letting the egg use its energy to grow the embryo instead of fixing the sperm.
Precisely. You are optimizing the genetic contribution of both partners simultaneously.
So we have explored the biological mechanics of increasing blood flow, correcting hormonal signaling, and cooling inflammation and oxidative stress. But if we trace all of these physical symptoms backward, our sources indicate they almost always converge under one overarching trigger, which is psychosocial stress.
The psychological toll of navigating infertility is immense, and it acts as a biological factor in and of itself. I always say it is not just in your head, it is in your bloodstream.
We touched on the fight-or-flight response, downregulating the HPG axis earlier, but how does managing that overarching stress specifically translate into clinical outcomes for patients undergoing IVF?
It comes down to measurable physiological markers, specifically cortisol. Cortisol is our primary stress hormone.
Right.
When cortisol levels are chronically high, the body diverts resources away from producing reproductive hormones like estrogen and testosterone. By utilizing acupuncture and holistic care to reliably lower anxiety, you lower cortisol. This protects spermatogenesis in men and regular ovulation in women.
So you stop the body from constantly hitting the panic button, which prevents the hormonal cascade from collapsing.
Exactly. Furthermore, when you look at integrated whole system programs, they significantly reduce treatment-related distress. Patients undergoing IVF are dealing with a grueling schedule of injections, ultrasounds, waiting for phone calls.
It's a full-time job.
It is. If integrative care makes them feel less overwhelmed, they are much more likely to adhere to their treatment protocols. They stay the course, which indirectly but massively improves the overall success rates of assisted reproductive technology cycles.
Which brings us to a really fascinating turning point in our sources. Having the clinical data on nitric oxide and cytokines and cortisol is one thing.
Yeah.
But someone actually had to build the blueprint for how to combine these ancient holistic therapies with modern, highly clinical IVF centers. Like, how do you merge the two practically?
Right. It requires an incredibly specialized approach. And the historical context provided in our sources introduces a pioneer who really defined this integration.
Yes. The sources highlight Mike Berkeley. He is the founder and clinical director of the Berkeley Center for Reproductive Wellness, which is located in Midtown East Manhattan. And what I found so compelling is that his foray into this wasn't purely academic. It started with a deeply personal origin story. He watched his own wife struggle profoundly with infertility.
Yeah, that intimate understanding of the patient's vulnerability often serves as the catalyst for the most dedicated medical practitioners. They see the gaps in care firsthand.
Exactly. That experience drove him to pursue extensive training, mastering both acupuncture and herbal medicine. And by the late 90s, around 1997 or 1998, he achieved something truly groundbreaking. He became the very first acupuncturist in the United States to dedicate his practice entirely to reproductive health.
If we connect this to the bigger picture of reproductive endocrinology at the time, that was a massive paradigm shift.
Oh, I bet.
Before his work, acupuncture in the U.S. was largely viewed as a generalized practice, mostly utilized for, pain management. By focusing exclusively on fertility, he helped establish traditional Chinese medicine as a credible, highly specialized complementary therapy within the incredibly data-driven, evidence-based world of reproductive endocrinology and infertility, or REI.
He wasn't just opening a clinic, he was essentially building the infrastructure for an entirely new subspecialty.
He really was instrumental in professionalizing the integration. He played a key role in designing and implementing the American Board of Oriental Reproductive Medicine.
The ABORM.
Yes. This was critical because it established rigorous standards and board certifications. It meant an IVF doctor could look at an acupuncturist and know they had verified specialized training in reproductive medicine. He also developed highly specific protocols tailored to enhance IVF and IUI outcomes, such as timing treatments to optimize the precise window of embryo transfer.
Looking at how the Berkeley Center operates today, based on our materials, it is a perfect case study of these biological mechanisms in action. They don't just blindly apply acupuncture, they blend time-tested TCM with modern Western medical insights. For instance, they utilize Western blood panels and semen analysis to guide which specific herbal antioxidants or acupuncture pathways to target.
They are looking at the exact same data the IVF clinic is looking at, but addressing it through a different modality.
And they've also incorporated technologies like low-level light therapy or photobiomodulation, which uses specific light wavelengths to stimulate cellular ATP production, literally giving cells more energy to function. And recognizing the stress factor we just talked about, they even offer home visits in Manhattan.
That's huge.
Right. If you are in the middle of an intense IVF cycle, not having to commute across the city to get your stress reduction treatment is a massive logistical relief.
It is the definition of holistic, patient-centered care. They are simultaneously addressing the male factor oxidative stress, optimizing female endometrial blood flow, balancing the HPG axis, and cooling inflammation, all while communicating collaboratively with the patient's primary fertility clinic.
Now, as always on this deep dive, we have to look objectively at the totality of our sources. We have to provide an impartial disclaimer here. While the biological mechanisms we've unpacked, the nitric oxide release, the cytokine reduction, while those are thoroughly documented, our sources do note that broader clinical evidence quality can vary. Some systematic reviews show low to moderate certainty regarding overall live birth rates.
Which is common in this field, honestly, because outcomes depend incredibly heavily on the specific protocols used, the underlying causes of infertility in the patient populations, and how seamlessly the complementary care is integrated with standard medical treatments.
Absolutely. So you should always consult a licensed practitioner and your primary fertility specialist before making any changes to your care plan. But if you or your partner are navigating this blizzard and you want to explore how to biologically support your medical treatments, the Berkeley Center is highlighted in our sources as a foundational resource. You can review their integrated approach at www.berkeleycenter.com or reach them for a free consultation at 212-685-0985. We want to make sure you have that information.
It is ultimately about giving yourself every possible supportive advantage by treating the whole system, rather than just isolated symptoms.
So what does this all mean for you listening today? Whether you are prepping for your own medical consultation or maybe you are supporting a friend who is just deep in the trenches of fertility treatments, having this mechanistic vocabulary is incredibly empowering.
It really shifts the narrative. You are no longer just a passive participant waiting to see if a medical procedure works. You understand how the microenvironment matters.
We've learned that you can actively influence the physical environment by increasing microcirculation and tissue oxygenation. You can influence the chemical messengers by modulating the nervous system to restore hormonal balance.
Right.
You can cool the inflammatory environment by neutralizing reactive oxygen species to protect cellular DNA.
Mm-hmm.
And you can manage the overarching stress response to keep cortisol from disrupting the entire process. Knowing that the underlying biology of your body can be actively supported makes the journey feel well, a little less blindfolded.
And this raises an important final question to leave you with. We've just spent this time exploring how incredibly localized treatments, like a targeted microtrauma from a tiny needle, can fundamentally alter deep microcirculation, cool immune responses, and reset complex hormonal axes within the reproductive system.
Yeah.
If that is possible, it makes you wonder what other localized chronic conditions might modern medicine be completely misunderstanding by only trying to treat them through a systemic pharmaceutical lens.